thank you to the CityBiz audience for tuning in today. Artificial intelligence is revolutionizing nearly every industry, and healthcare is no exception. Within drug development, AI is becoming an essential tool, transforming how therapies are discovered, developed, and delivered. No longer do we need to rely on time-consuming lab-based trial and error. Instead, by harnessing the power of AI, companies are accelerating the timeline from initial discovery to market, ensuring more precise, effective, and patient-centered treatments. Today, we are speaking with Dr. Jennifer Bath, the CEO and president of ImmunoPrecise Antibodies, or IPA, a company at the forefront of using AI to reimagine therapeutic antibody discovery and development. Dr. Bath, thanks for joining us today.
Thank you for having me, Reena.
So IPA is really doing some exciting and innovative work in the therapeutic antibody space, especially with how you're integrating AI to tackle drug discovery challenges. For listeners who might not be as familiar, can you share a bit more about what IPA does and how your approach is reshaping the way therapies are developed?
Sure, absolutely. So what IPA does is we build therapeutic drugs fully end-to-end, meaning we take into account every component, discovering that novel drug, characterizing it, optimizing it for patient use and for clinical manufacturing. And we do this both internally for our own drug production and then separately in a different arm of the company, also for large pharma, small pharma, and biotech. And, you really touched on there in your introduction, really what is continuing to set IPA apart more and more. It is our artificial intelligence and the software that we have coded called Lens AI, and that is now enabling us to do this end-to-end antibody work entirely in silico. So ourselves and also our clients are able to do that work within software at a fraction of the cost and in a fraction of the time.
That's great. And, in the field of therapeutic discovery, it's moving so quickly. It feels like there's always something new and groundbreaking happening. From your perspective, what's the most exciting development in the industry right now? And how is IPA focusing its efforts in the year ahead to stay ahead at the forefront of innovation?
Yeah, that's a great question because there are so many things that are occurring. And so I think there's a couple of different components. I mean, one is we just see continued exploration into a variety of different, what we call antibody modalities. So people working with antibodies and other ways to target different proteins or regions of the body much more specifically than we could previously. And then I would go back really to the AI aspect of what we're doing. I think that the amount of leaps and bounds that have happened in the last 12 months in the industry, applying AI to drug discovery and the types of insights that we're now getting that we couldn't get, 12 months or 18 months ago, I think has really surprised even people in the industry. There's a lot of building upon, group knowledge, group think knowledge, open access information, but also just a real acceleration of technology.
No, you're right. And makes a great point. And despite the challenging funding environment in recent years, it's really inspiring to see so many early to mid-stage biotech companies continuing to innovate and push those boundaries. Let's take a minute to talk about the market landscape. With therapeutic antibody development growing so quickly and rapidly, what does the market size and opportunity look like right now? And how is IPA navigating the environment and positioning itself for success?
Yeah, that's a fantastic question because we've seen in the last 12 to 24 months a dramatic slowdown in the biotech market space. And as you said, challenges in funding, which I think has really particularly hit pipeline companies the hardest, who really rely on that funding as opposed to a revenue stream. And, when we look at the market potential, it still does continue to be very strong. I think what has really been important in the last several years has been companies that can differentiate themselves and make themselves critical during this time. And there's a number of ways different companies have done that. We've done that by ensuring that we are really spanning the end-to-end continuum of drug discovery and that we're doing it at the highest quality possible. And so people never have a reason to need to go somewhere else. They can come to us and stay with us and be very confident in the product that they're going to get back. And for us, the AI integration has been a pivotal part of that. We now see many of our largest clients really gravitating, in some cases solely, to our software component of what we do because of the speed. And then in addition to that, getting back the same quality or even more accuracy and precision in their results. But when we look at, positioning ourselves, it's really interesting. Going back to just how dynamic this market is and this industry is, our rollout, plan for our software has always been first and foremost these clients that we work with. We've got 19 of the top 20 pharma. We have over 750 different clients that we have been working with, and of course, we know their demands, we know their needs and their pain points. So this has been an obvious target market for us. What I think we didn't fully appreciate until more recently was just how those relationships we've built can benefit other companies in the technology sector, in the AI sector, especially when we bring our different skills and our different technologies together. So we're now, looking at, chip manufacturers and cloud providers and different types of technology groups where we're all recognizing that, the sum of our parts is much greater than anticipated. And so as we look at positioning ourselves going forward, we're acutely aware that, yes, we have this industry, this market that's in drug discovery, but it's also so much broader than that. And then beyond the drug discovery component and the ability for different companies to utilize our software and provide us with monthly or annual recurring revenues, there's also a component of what we call data management. When they're doing all of these analysis, who will organize their data and manage their data for them? And so for us, that positioning and taking advantage of the multiple ways that we can contribute to the life sciences, this becomes also a really important focus for us.
Makes complete sense. And I know IPA has a strong interest in AI-driven drug development, particularly with the focus on oncology. Why is that an area of focus for the company? Can you tell us a little bit more about the impact IPA is making in this space, especially when it comes to leveraging AI to tackle some of the most complex challenges in cancer treatment?
Yeah, that's actually a great question because, the reality is we are disease agnostic. And with respect to that, when we go after a particular target or protein associated with a disease, we're also, protein family agnostic. So there's really nothing we would consider too difficult for us to tackle. We love trying new targets and going after more challenging diseases. And that's part of where we built our reputation. We really are known in the industry for being able to go after some of the most difficult programs and then having a very high success rate. And so we find that when we're collaborating with another group or when another group is really just coming to us to perform particular services for them, that they do bring us those most challenging programs. And today, what we've really seen across the board with a variety of diseases is that the targets we're going after are more and more sophisticated than they used to be. It's almost like the easier targets were the lower hanging fruit, and those were able to be tackled with older technology. And now, as the targets are getting more complex and understanding them and modeling them, which is very, very helpful component for artificial intelligence, becomes more critical, we're finding that those are the types of programs that more frequently people are bringing us. And so those do tend to be associated very much with oncology, these more challenging targets, these more, quite serious and deadly diseases. So we do find that we get more active requests for partnerships and collaborations around that space because of our reputation for being successful on really challenging targets. So that's definitely a big component of that. And with respect to the part of your question around tackling that with artificial intelligence, I think that, once people realize that, hey, we are able to solve problems using our Lens AI software that others haven't been able to solve, it just fits so well into, that challenge that people have about, where is that innovation occurring that's going to let us, take on this next level of oncology therapeutics. And And then just to connect that very tangibly to our software, I think this is where the uniqueness of our software really shines in our AI. We have the only algorithm at the heart of our software that is based on pattern recognition, these very specific patterns that have evolved over time to actually dictate what we call the function of a particular molecule. So this pattern recognition at the heart of our software is something that we are able to use to investigate and analyze sequence information, for instance, like a patient genome, or even at the amino acid level, maybe a biopsy or an image from some sort of like radiographic image, or actual text, so electronic health record or literature pertaining to a disease. So our software at the heart of it, because it uses pattern recognition that is able to bring together and analyze multiple forms of data, in this day and age with oncology, it is a tool, an unprecedented tool that enables us to take all of this information about a patient and get a very holistic view on all of the information, the data, what's happening with that patient, what's happening with the disease, getting a better understanding of the types of drugs that might be safest for that patient, that might be the most efficacious for that patient. And so with respect to your question about oncology, I think a lot of it too just comes back to being very fortunate based on this discovery of this pattern recognition by our subsidiary BioStrand to have this software that gives us glimpses into the whole complexity of these oncological diseases and to have novel insights into how to treat these patients.
No, definitely. And, in speaking about where the innovation is occurring, I know earlier this month you attended the annual JP Morgan Healthcare Conference, clearly one of the largest and most influential healthcare investment symposiums, bringing together global industry leaders and innovators. Was there anything new or particularly interesting that stood out to you, and any trends or development areas you saw that look especially promising in the biotech space?
Yeah, that's a great question. I think a lot of the eyes are on the biotech market. Is it going to recover? We heard a lot of times that phrase is 2025 the year that biotechnology arises from the ashes. And really, to be honest, I think the phrase being used was cautious pessimism. I think there is still concern around the market with regard to biotechnology and people's ability to access funding. On the flip side, there was a lot of excitement around just changes happening from a political level, how some of that might actually impact people's risk tolerance. And I think giving a little bit more, hope for the investment community too, who obviously is suffering just as much as, companies. On the flip side of that, IPA has really transitioned much more into a technology and AI company over the past 2 years, more so than really being a straight biotechnology player. So from the perspective of the conversations that we had and some of the panels we participated in and attended, what also really stuck out for me is going back 12 months ago, there was so much apprehension about AI. So much concern about it, okay, is it really there, right? People were getting more and more comfortable with generative AI, but much more on that's something that helps me write emails, write a nice letter. And now what we've seen is that not only are various aspects of AI a part of everyday life for people, but researchers are realizing that, I'm actually getting really good, reliable results with some aspects of artificial intelligence. And so we're seeing that pessimism kind of clear out. We're seeing more and more enthusiasm about what people can do, whether it's specifically in drug discovery or incorporating large language models, and starting to think ahead about, the realization is that this is really the way forward, and it's happening faster than most people realized it would. And for really most of the people that we spoke with, kind of questioning, how do we move there so we don't get left behind? So a very different reality than even 1 year ago at JP Morgan. We found that to be exhilarating, really fun, really dynamic conversations, a lot of excitement from groups about everything that can be done now in AI. So, yeah.
No, that's great. And I think that, right, everyone would probably agree that biotech is so complex and it's rapidly changing. It's a rapidly evolving field. And just like you said, it sometimes feels like there can be a gap between what's happening on the ground and what is perceived by investors. What do you wish investors understood better about what IPA specifically is doing in the broader state of the biotech industry right now?
You know, I would have to go back to our software and say that I really wish there was a more comprehensive understanding of just how powerful the pattern recognition that we have is, and why that's so important in areas of like personalized and precision medicine. With that ultimate goal of making more precise and safer drugs for patients, it's hard to imagine how people can really significantly accomplish the milestones that we'd like to in the healthcare industry without this pattern recognition that we have patented. So I think for us, that's that's really something that we hope people can gain a better understanding of. And as we produce more and more case studies and demonstrations of outputs, I think we're moving toward that.
Sure, definitely. Use cases help. Dr. Bath, thank you so much for taking the time to speak with us today. It's been a really insightful conversation, very exciting things happening. Before we wrap up, is there anything else you'd like to share with our listeners, especially, and for those who want to learn a little bit more about IPA and the work you're doing, maybe what's the best way to stay connected and get more information as well?
Yeah, absolutely. So what I'd like to share is, if you'd like to learn more, you can always find out more on our website, ipatherapeutics.com. We also post our most recent press releases there. We had a really fun press release there this morning, releasing information about the very first molecule that we've produced 100% in silico as a therapeutic against diabetes, to help treat diabetes. And so you can always stay up to date right there on the investor portion of our website and see, what is new, what are we doing, and where we're going to be at presenting and all of those fun things.
That sounds great. Thanks so much, Dr. Bath.
Thanks
to the City Biz audience for joining today.